NCLEX PN questions with correct answers 2026. Question 1. A newborn client is seen in the emergency room for vomiting. Which assessment finding indicates a possible emergency? Option A, a vomit that is green. Option B, vomit that contains curdled milk. Option C, vomit that occurs immediately after feeding. Option D, vomit that is clear and watery. The correct answer is option A, vomit that is green. Vomit that is green indicates a possible intestinal obstruction where stool cannot pass and comes back up as green vomit. This requires immediate medical evaluation. Question 2. The nurse observes a student performing chest compressions on an adult client. Which technique indicates that the student understands how to provide high-quality chest compressions during cardiopulmonary resuscitation? Option A, compressing the chest to a depth of at least 2 inches or 5 centimeters. Option B, maintaining a compression rate of 60 to 70 beats per minute. Option C, leaning slightly on the chest between each compression to rest. Option D, pausing compressions for 15 seconds to deliver rescue breaths. The correct answer is option A, compressing the chest to a depth of at least 2 inches or 5 centimeters. High-quality chest compressions for an adult require a depth of at least 2 inches or 5 centimeters to adequately circulate blood to vital organs. Question 3. A 2-year-old at an outpatient clinic stops breathing and does not have a pulse. Cardiopulmonary resuscitation is initiated. When the automated external defibrillator arrives, the nurse notes that it has only adult automated external defibrillator pads. What is the appropriate action at this time? Option A, place one pad on the center of the chest and the other pad on the middle of the back. Option B, place both pads on the anterior chest making sure they do not touch. Option C, wait to use the defibrillator until pediatric pads can be obtained from another unit. Option D, cut the adult pads in half to fit the chest of the child properly. The correct answer is option A, place one pad on the center of the chest and the other pad on the middle of the back. If pediatric pads are unavailable, adult pads should be used on a child by placing one on the center of the chest and one on the center of the back to prevent the pads from touching. Question 4. A practical nurse is evaluating the external fetal monitoring strip of a laboring prima gravida who is at 36 weeks gestation. Which nursing interventions should the practical nurse anticipate when there is found to be late decelerations? Option A, administer supplemental oxygen by mask. Option B, increase the intravenous fluid rate. Option C, stop the oxytocin infusion. Option D, prepare the client for an immediate emergency amniocentesis. Option E, instruct the client to push forcefully with each contraction. Option F, place the client in a supine position to promote blood flow. The correct answers are options A and B and C. Administer supplemental oxygen by mask. Increase the intravenous fluid rate. Stop the oxytocin infusion. Late decelerations indicate uteroplacental insufficiency. Immediate interventions include stopping oxytocin, increasing intravenous fluids, and administering oxygen to optimize fetal oxygenation. Question 5. A client who is pregnant at 30 weeks gestation comes to the prenatal clinic. Which vaccines may be administered safely at this prenatal visit? Option A, inactivated influenza injection. Option B, tetanus, diphtheria and pertussis vaccine. Option C, measles, mumps and rubella vaccine. Option D, varicella zoster live vaccine. Option E, human papillomavirus vaccine. The correct answers are options A and B, inactivated influenza injection, tetanus, diphtheria and pertussis vaccine. Inactivated vaccines such as the influenza injection and the tetanus, diphtheria and pertussis vaccine are safe and recommended during pregnancy. Live vaccines are contraindicated. Question 6. The nurse is reinforcing education to a pregnant client who is human immunodeficiency virus positive. Which information is appropriate for the nurse to include? Option A, prescribed antiretroviral therapy should be continued during pregnancy. Option B, breastfeeding is recommended to transfer maternal antibodies to the newborn. Option C, the newborn will receive a live attenuated viral vaccine immediately after birth. Option D. Antiretroviral medications should be paused in the first trimester to prevent birth defects. The correct answer is option A. Prescribed antiretroviral therapy should be continued during pregnancy. Pregnant women who are human immunodeficiency virus positive should continue their prescribed antiretroviral therapy to reduce the viral load and prevent transmission to the fetus. Question 7. A nurse is reinforcing information on formula preparation for a client with a newborn. Which statements by the client indicate proper understanding? Option A. I must wash the top of the concentrated formula can before opening it. Option B. Prepared formula should be kept in the refrigerator and discarded after 48 hours. Option C. I will warm the bottle in the microwave for 30 seconds before feeding. Option D. Leftover formula in the bottle can be saved for the next feeding. Option E. I should dilute the formula with extra water to prevent constipation. The correct answers are options A and B. I must wash the top of the concentrated formula can before opening it. Prepared formula should be kept in the refrigerator and discarded after 48 hours. Washing the can top prevents contamination, and prepared formula can be stored safely in the refrigerator for up to 48 hours. Microwaving, saving leftover milk, and diluting formula are unsafe practices. Question 8. A practical nurse is assisting the registered nurse to care for a 6-hour-old term newborn of a mother with gestational diabetes. A bedside capillary blood glucose reveals the newborn blood glucose is 45 mg per deciliter. The newborn is asymptomatic. Which intervention should the practical nurse anticipate implementing first? Option A. Feed the newborn. Option B. Administer intravenous dextrose immediately. Option C. Swaddle the newborn and reassess the glucose in 1 hour. Option D. Notify the healthcare provider to request a metabolic panel. The correct answer is option A. Feed the newborn. A blood glucose of 45 mg per deciliter is on the lower end of normal. For an asymptomatic newborn, the first appropriate intervention is to provide an oral feeding. Question 9. The nurse is reinforcing instructions to a client at 34 weeks gestation who is preparing to travel by airplane. Which of the following instructions are appropriate? Option A. Carry a copy of your most up-to-date prenatal record. Option B. Increase fluid intake before and during the flight. Option C. Secure the lap belt below the abdomen and across your hips when seated. Option D. Wear compression stockings and loose-fitting clothing. Option E. Sit near the window and remain in your seat for the entire flight to avoid falls. The correct answers are options A and B and C and D. Carry a copy of your most up-to-date prenatal record. Increase fluid intake before and during the flight. Secure the lap belt below the abdomen and across your hips when seated. Wear compression stockings and loose-fitting clothing. Pregnant travelers should carry prenatal records, stay hydrated, wear lap belts below the abdomen, and use compression stockings to prevent deep vein thrombosis. Prolonged sitting should be avoided. Question 10. A client indicates to the nurse a desire to become pregnant. The client drinks 1 to 2 glasses of wine on weekends and has a body mass index of 32. Which teaching should the nurse reinforce as part of proper preconception health care for this client? Option A. Avoid eating undercooked hamburgers. Option B. Receive a rubella vaccine at least 3 months before attempting pregnancy. Option C. Take 0.4 mg of folic acid supplementation daily. Option D. Continue drinking a maximum of 1 glass of wine per week during the first trimester. Option E. Begin a strict calorie deficit diet to reach a normal weight before conceiving. The correct answers are options A and B and C. Avoid eating undercooked hamburgers. Receive a rubella vaccine at least 3 months before attempting pregnancy. Take 0.4 mg of folic acid supplementation daily. Preconception teachings include avoiding undercooked meat for toxoplasmosis prevention, receiving rubella vaccination prior to pregnancy, and taking daily folic acid to prevent neural tube defects. Question 11. Which of the following clinical findings should the nurse recognize as expected when monitoring a newborn? Option A. Cyanosis of the hands and feet. Option B. Heart rate of 150 beats per minute. Option C. A respiratory rate of 20 breaths per minute. Option D, central cyanosis around the lips and mucous membranes. Option E, a temperature of 96 degrees Fahrenheit. The correct answers are options A and B, cyanosis of the hands and feet, heart rate of 150 beats per minute. Acrocyanosis or cyanosis of hands and feet and a heart rate of 110 to 160 beats per minute are normal expected findings in a healthy newborn. Question 12. The student nurse observes the respiratory therapist preparing to draw an arterial blood gas from the radial artery. The respiratory therapist performs the Allen test and the student asks why this test is performed before the blood sample is drawn. Which statement made by the respiratory therapist is the most accurate? Option A. The Allen test is done to determine the patency of the ulnar artery. Option B. The Allen test is done to determine the patency of the radial artery. Option C. The Allen test is done to measure the capillary refill time of the digits. Option D. The Allen test is done to evaluate the risk for developing a deep vein thrombosis. The correct answer is option A. The Allen test is done to determine the patency of the ulnar artery. The Allen test is conducted to ensure collateral blood flow through the ulnar artery is sufficient in case the radial artery becomes occluded after the puncture. Question 13. The practical nurse assists the registered nurse while recognizing that an oxytocin infusion can lead to which of the following maternal and fetal complications? Option A, fetal distress and the need for a cesarean birth. Option B, gestational diabetes and excessive maternal weight gain. Option C, placenta previa and premature rupture of membranes. Option D, oligohydramnios and fetal renal agenesis. The correct answer is option A, fetal distress and the need for a cesarean birth. Oxytocin stimulates uterine contractions which can lead to uterine tachycystole causing fetal distress and potentially necessitating an emergency cesarean birth. Question 14. The nurse is monitoring a client who is in active labor with a cervical dilation of 6 centimeters. Which finding requires intervention by the nurse? Option A, contraction duration of 95 seconds. Option B, contraction frequency every 3 minutes. Option C, fetal heart rate of 140 beats per minute. Option D, maternal blood pressure of 120/80. The correct answer is option A, contraction duration of 95 seconds. A contraction duration lasting longer than 90 seconds can significantly reduce placental blood flow and fetal oxygenation requiring immediate intervention. Question 15. The nurse is reinforcing instructions to a postpartum client about umbilical cord care for the newborn. Which client statement indicates a need for further teaching? Option A, I will secure the diaper over the cord to protect it. Option B, I will clean around the base of the cord with warm water if it becomes soiled. Option C, I will fold the top edge of the diaper down to keep the cord exposed to air. Option D, I will notify the pediatrician if I see any redness or purulent drainage. The correct answer is option A, I will secure the diaper over the cord to protect it. The diaper should be folded down below the umbilical cord to expose it to the air, allowing it to dry properly and preventing contamination from urine or feces. Question 16. The nurse preceptor should intervene if the graduate practical nurse performs which action when caring for a jaundiced newborn being treated with phototherapy? Option A, applying a shirt while the newborn is exposed to phototherapy. Option B, placing protective eye shields on the newborn during treatment. Option C, monitoring the temperature of the newborn frequently. Option D, keeping the newborn in only a diaper during the phototherapy session. The correct answer is option A, applying a shirt while the newborn is exposed to phototherapy. Applying clothing blocks the therapeutic light. The newborn should only wear a diaper and protective eye shields to maximize skin exposure to the phototherapy lights. Question 17. The home health nurse is providing care for a 6-year-old client who has a tracheostomy and is being mechanically ventilated when the ventilator apnea alarm sounds. The nurse finds the client to be unresponsive and pulseless and there are no other caregivers present. Which action should the nurse take first? Option A, begin chest compressions immediately. Option B, provide 2 rescue breaths using a bag valve mask. Option C, assess the tracheostomy tube for mucus plugs. Option D, call emergency medical services before starting resuscitation. The correct answer is option A, begin chest compressions immediately. In an unwitnessed cardiac arrest for a pediatric patient without a pulse, the nurse should immediately begin cardiopulmonary resuscitation, starting with chest compressions before seeking help. Question 18. A nurse is reinforcing teaching to a client that breastfeeds who has been diagnosed with mastitis of the right breast. Which of the following instructions should be included? Option A, increase oral fluid intake. Option B, take ibuprofen as needed for pain. Option C, stop breastfeeding immediately from the affected breast. Option D, wear a tight binding bra to reduce milk production. Option E, apply cold compresses continuously to reduce milk flow. The correct answers are options A and B, increase oral fluid intake, take ibuprofen as needed for pain. Treatment for mastitis involves increasing oral fluids, administering analgesics such as ibuprofen for pain, and continuing to breastfeed to empty the breast and prevent abscess formation. Question 19. On postpartum day 3, the nurse is reinforcing education on diaper changes and discharge. The client states, I think my baby has a dirty diaper. I cannot change it as well as you can. Will you change my baby diaper for me? What is the best response by the nurse? Option A, I will stay at the bedside and watch while you change the diaper. Option B, I will change it this time, but you have to do it when you go home. Option C, you need to practice this yourself because I have other patients to see. Option D, let me change the diaper while you take notes on my technique. The correct answer is option A, I will stay at the bedside and watch while you change the diaper. The nurse empowers the mother by offering support and supervision while allowing her to build confidence through hands-on practice with newborn care. Question 20. A nurse is caring for a client following the delivery of a stillborn infant. Which of the following actions should the nurse take? Option A, ask the parents if they would like to help bathe the infant. Option B, encourage the parents and family members to hold the infant. Option C, offer to obtain handprints, footprints, and photographs of the infant. Option D, quickly remove the infant from the room to prevent maternal distress. Option E, advise the parents to wait until later to grieve and focus on their own physical recovery. The correct answers are options A and B and C. Ask the parents if they would like to help bathe the infant. Encourage the parents and family members to hold the infant. Offer to obtain handprints, footprints, and photographs of the infant. Therapeutic care for a stillborn infant involves offering the parents the opportunity to participate in care, hold their baby, and create memory boxes to assist with the grieving process. Question 21. The nurse is performing an assessment on a 39-week neonate an hour after a spontaneous vaginal delivery. What are common expected newborn findings? Option A, plantar creases up the entire sole. Option B, toes fan outward when the lateral sole surface is stroked. Option C, white pearl-like cysts on gum margins. Option D, a single transverse crease across the palm of the hand. Option E, jaundice of the sclera and chest within the first hour of birth. Option F, a heart rate of 80 beats per minute while resting. The correct answers are options A and B and C. Plantar creases up the entire sole. Toes fan outward when the lateral sole surface is stroked. White pearl-like cysts on gum margins. Expected findings for a term neonate include full plantar creases, a positive Babinski reflex where toes fan outward, and Epstein pearls on the gums. Jaundice in the first 24 hours is abnormal. Question 22. A nurse is participating in an obstetrical emergency simulation in which the healthcare provider announces shoulder dystocia. Which of the following interventions should the assisting nurse implement? Option A, document the exact time the fetal head was born. Option B, flex the client legs back against the abdomen and apply downward pressure above the symphysis pubis. Option C, request additional assistance from other nurses as soon as possible. Option D, apply fundal pressure to help push the infant out of the birth canal. Option E, administer intravenous oxytocin to increase the strength of uterine contractions. The correct answers are options A and B and C. Document the exact time the fetal head was born. Flex the client legs back against the abdomen and apply downward pressure above the symphysis pubis. Request additional assistance from other nurses as soon as possible. During shoulder dystocia, the nurse should track time, apply the McRoberts maneuver and suprapubic pressure and call for help. Fundal pressure is contraindicated as it can cause uterine rupture. Question 23. A client who is being evaluated for suspected ectopic pregnancy reports sudden onset severe right lower abdominal pain and dizziness. Which of the following additional assessment findings will the nurse anticipate if the client is experiencing a ruptured ectopic pregnancy? Option A. A blood pressure of 82/64. Option B. A pulse of 120 beats per minute. Option C. Referred shoulder pain. Option D. A bounding radial pulse with a flushed face. Option E. A sudden increase in urinary output. The correct answers are options A and B and C. A blood pressure of 82/64. A pulse of 120 beats per minute. Referred shoulder pain. A ruptured ectopic pregnancy causes internal hemorrhage leading to hypovolemic shock marked by hypotension, tachycardia, and referred shoulder pain from diaphragmatic irritation. Question 24. The nurse is collecting data on a client who has arrived at the clinic for pregnancy confirmation and prenatal evaluation. Which of the following findings indicate diagnostic positive signs of pregnancy? Option A. Fetal heart tones detected by a Doppler device. Option B. Visualization of the fetus via ultrasound. Option C. A positive home urine pregnancy test. Option D. Maternal reports of fetal movement or quickening. Option E. Amenorrhea for the past 2 months. The correct answers are options A and B. Fetal heart tones detected by a Doppler device. Visualization of the fetus via ultrasound. Positive diagnostic signs of pregnancy are conclusive evidence such as fetal heart tones, fetal visualization via ultrasound, and fetal movement felt by a provider.